Hi, my name's Alex, and I'm the Clinic Coordinator of the Pinnacle Points, and today I'm going to be walking you through at-home injections. We do offer for all of our patients to come in and receive their injections in-house, but if you are looking for a little bit more of the convenient option, certainly we do encourage you to explore the at-home option. Today, I'm going to show you a couple of my own methods when I do my own injections, and just to maybe give you a little bit of insight and help. Now, for all of our patients who do their own injections from home, we do recommend that you review the literature included with your medication order provided by Empower Pharmacy, okay? It's very important that you review this information and that it covers two major components. The first one being safe handling of medications, and the second one being viable spots of intramuscular medication administration. So with that being said, if you're still struggling with the concepts presented in that literature, I am going to show you the ways that I do my own injections, as I find that they're a little bit easier. So first, let's do a quick review of the supplies that we're going to be utilizing today. So here we have our medication vial, which is just a stock test vial of medication. It's not real. So we're going to set that back down here for a moment, and we have the rest of our supplies. We have a 1 cc or 1 ml Laura slip tip syringe. It's called a slip tip because it doesn't have any threading on the tip of the syringe here to actually screw your needle into. We have two different gauge size needles. The first one is going to be a larger bore 18 gauge 1-inch needle that we're going to use to draw our medication. And the second one is going to be a smaller bore 23 gauge 1-inch needle that we're going to use to administer our medication. Okay, so a larger needle to draw, a smaller needle to administer. We also have two alcohol prep pads. Why two? Because one is going to be used to disinfect the surface of our medication vial, and the other one is going to be used to disinfect us. The two main areas that we focus on with our patients are injections in the legs and injections in the dorsal gluteal area right here off the hip. So a really easy way to identify the location in your leg, what we're trying to do is hit the outermost aspect of the quadriceps muscle. So a nice little cheat that you can do is to be in a sitting position. You want to be nice and relaxed, concentrate on your breathing, don't hold your breath. You want to take whichever hand, whichever extremity you're going to be working on. Let's say today we're going to do my right leg. You're going to take your right hand, spread it, take your thumb, put it in your right groin, take your hand, spread it across your leg. And what you want to make sure is that your middle finger is pointing straight at your kneecap, okay? You want it to be nice and perpendicular so it forms that nice perfect T, okay? And what we're looking for right here is this triangulation between our pinky finger and our ring finger. And what we're looking for is to draw in an imaginary line from the tip of that pinky finger to the tip of the ring finger. And what you're going to do is visualize a dime, about the diameter of a dime, and you're going to drop it right on that line, right in the middle. Okay, that is going to be the spot that we're trying to get to with the needle. So what you'll do is adhere to your safe handling of medications protocol. Of course, we've already done our good hand hygiene. We've already disinfected the vial surface that we'll be getting our medication from. At that point, you're then going to take another alcohol prep pad and vigorously disinfect that area for a good 15 seconds, okay? We'll let that air dry. At this point, we already have our testosterone dose all drawn up and ready to go. So we're gonna be, again, nice and relaxed, concentrating on our breathing. Do not wanna hold our breath, okay? We're going to take the hand of the leg that we are working on. Today, again, the right leg. You're gonna take that hand, bring it to the side of your leg, and you're gonna give your leg a good, nice, firm squeeze, okay? And while doing so, you want to ensure that you're not contaminating the area that you've disinfected with the alcohol prep pad. So nice and relaxed, don't want the leg to be all tensed up. Again, breathing. You're then going to take the syringe, you're going to bring it to the surface of your skin, straight up and down to the spot that we have designated and that we disinfected, straight up and down, 90 degrees to the surface of the skin, okay? You do not want to be going in at angles or anything like that. Keep breathing, and at this point, you're just going to slowly advance the needle all the way up to the hub of the needle itself, okay? So at that point, once the needle is all the way in, you're going to kind of change your grip, and at this point we are holding it like a pencil, right? You're going to change your grip and get to the top of the plunger slowly try to pull back on that syringe, okay? And what you should be feeling is a suction effect, okay? And this is just a simple little aspiration precaution that tells us, oh, we're not in any kind of major blood vessel or anything like that, meaning that we're not going to cause any harm to ourselves. So we can verify that we are within tissue and we are where we should be. And at this point, you're just gonna slowly give yourself the injection, okay? Again, breathing through it. Once you have administered the entire syringe, at that point, you're gonna let go, slowly withdraw the needle, and you're done. It's that easy. Now, if you do notice a little bit of blood, that's okay. You can take your alcohol prep pad that you use to disinfect yourself, put it to the surface of the skin, and just hold some good firm pressure, not really wanting to rub that area because all you end up doing is exacerbating it and causing it to bleed anymore. It might leave you a nice little bruise. So just hold some good firm pressure and that bleeding should subside in a moment of seconds. That's all. Pull it away and you're done. The other area that we'll be focusing in on today is this hip area back here that we call the ventral or dorsal gluteal injection. When we are doing our patients' injections, it's more dorsal. When the patients are doing their own, it's just more ventral, just meaning it's off to the side a little bit more. So the method that I like to utilize when I'm doing this injection is pretty easy. It's a little bit of a cheat. So what you'll end up doing is being in a sitting position, identifying which side you'll be doing, okay? Okay, let's do our right side again. So what you're looking to find is your hip bone right down here, okay? And what you're looking for is something called your iliac crest, which is this process here on the side of the hip bone, and it's always going to be most laterally to your person. Okay, if we're doing our right side, it's going to be my 3 o'clock. If we're doing my left side, it's going to be my 9 o'clock. So kind of like we did with the leg, where we're going to use our thumb to pinpoint a good area to find that anatomical landmark. We're going to take our thumb, put it on that area, okay? And what we're gonna do is reach back like we're trying to grab our own butt, okay? And what you wanna make sure is that your pointer finger is pointing straight down at the ground. You want to ensure that you're not coming off at any weird angles or anything like that. So thumb is on the process, on that bony prominence, on the side, always most laterally, reaching back like you're trying to grab your own butt. And what you're looking for right here again is the apex of this triangle between your middle finger and your pointer finger, okay? And what we're trying to go for is this spot right here at the top. Now, if you're at home wondering if you got the right spot, a couple things to take in mind. First of all, when you push that, it should be nice and squishy, okay? And that tells you that you're within the right vicinity, okay? There's a nice little fat pocket that sits on top of this muscle. That's what allows the needle to glide right on through like a hot knife through butter. You also want to make sure that this spot is below your hip. Well, how do we know that? Because we had our thumb on our hip bone. And as you can see, if my hip bone is here, this is the spot that I'm going to, and this is going to ensure that we don't go into our pelvis, which doesn't feel too good. At this point, unlike the leg that you have to grab, you don't have to grab this one. You're then going to take your alcohol prep pad, vigorously rub that area for a good 15 seconds, okay? Nice and relaxed, similar practice in that you're going to continue to breathe. Don't hold your breath. You're then again going to hold your syringe, okay? Kind of grab it by the base, and just straight up and down to the surface of the skin, okay? At that point, you're just going to put pressure on the skin with the needle tip. You're then going to advance the needle all the way in to the tip of the hub. You're then going to change your grip, kind of chalk up the bat here, so to speak. Find that plunger again, and before you do the injection, just slightly pull back and do that slight little aspiration precaution again. So what you're trying to replicate is that suction effect. And again, that tells you that you're within tissue and you're not in any kind of major blood vessel, okay? At that point, you're going to change your grip, whether you want to do the injection with a reverse push like that, whether you want to change it completely and push down like that, whether you want to push it with your palm. This is the part that you'll have to kind of figure out until you kind of feel what feels right for you. So myself, when I give my injection, I usually use my pointer finger and I just kind of slightly push down on the plunger. And at that point, you're just going to slowly administer the medication until it's all the way in. At that point, you're going to pull it out and you're done. Similar to the leg, if you do notice a tiny little bit of blood, just take your alcohol prep pad, hold it, just some good firm pressure. Don't rub or exacerbate that area, and just kind of hold some slight pressure until the bleeding subsides. It should subside in a matter of seconds. You pull it away and you're all done.